You either click here because of curiosity or because you or someone close to you has been recently diagnosed with cancer. The first question that comes to your mind is, what is cancer? Cancer is a disease of uncontrolled proliferation by transformed cells subject to evolution by natural selection. It is not a single disease, but rather a collection of similar diseases that affect different tissues of the body. I chose this definition because it includes the word evolution and natural selection, which is really important on understanding how cancer cells work and evolve to be able to cause the much damage they do to their hosts. How does cancer develop? Healthy cells operate under strict regulatory control that allow them and permit them to maintain bodily functions without harming the host. Cancer arises when these cells lose these strict controls and they start acquiring different abilities that permit them to invade and affect nearby tissues. The major reason this occurs is because these cells have suffered some type of DNA mutations that change the behavior of certain of their genes, especially oncogenes and tumor suppressor genes. So now let's talk about some cancer statistics. Cancer is among leading cause of death worldwide. In 2022, there were almost 20 million new cases and 9.7 million cancer-related deaths worldwide. Another question is there a cure for cancer? And then there's always this, let's say, conspiracy theory or misconception that pharmaceuticals are hiding the cure of cancer. The reality is that maybe many people that you know or are related to you have been a cancer survivor for more than 10 or 15 or even 20 years. So technically, many people are getting cured every day from cancer and they can continue and live healthy and prosperous lives. The thing is that every cancer is different and some cancers can actually go into remission and people can survive and some doesn't. And depending also on the person and the treatment available, that also affect their chances of survival. Luckily, in the last decades, a lot of progress has been done to treat certain types of cancers, which have helped a lot in helping people to be able to fight this disease accordingly. There's still a lot to do, and we hope we can keep progressing in this area. The first things that come to mind when people talk about cancer treatment is chemotherapy. And let's be real, chemotherapy sucks. For everyone that goes through that, or if you know someone or you're related to someone that went through that, it's not an easy thing. And many people choose not to do it depending on their situations. But the reality is that the reason it's still used is because for many cancers it works. The way it works is that it's a bit of a drastic attack, is that it affects all dividing cells. And because cancer cells are constantly dividing, they are, let's say, depending on the therapy, mostly highly affected, and that's how they can kill the cancer. But it also affects healthy cells that are always dividing. For example, epithelial tissue that's always dividing and need to replenish itself is also affected by chemotherapy. That's why many people experience nausea or experience hair loss or experience other side effects from chemotherapy. By no chance this is perfect, and by no chance this is the best treatment we have. And that's why there is a lot of research being done in new avenues of treatment. So let's first talk about what are the causes of cancer. And before we talk about what are, let's say, some known causes, let's think about how can we really know if something is causing cancer or not. And of course, you need some type of research being done and some type of experimentation or study that can prove these claims or hypotheses. And because of ethical reasons, we cannot just give a mutagen, which is anything that can cause a mutation, to someone and see what are the effects and see if the person developed cancer. We're lucky we don't live in this world that people are doing this type of experiments anymore. Instead, we have to rely either on observational studies, which is people that are being, let's say, in contact with certain chemical or certain, let's say, radiation or whatever thing we want to measure and see the rates of cancer compared to the normal population. And we also need to do other, let's say, models. For example, people use animal models in experiments where they actually give this mutagen, the chemical or whatever, to an animal, or even to microorganisms, even like bacteria or yeast cells, to see if they, or just also like normal human cells, to see if they develop some type of cancer or they develop mutations. There's also ethical guidance to follow when doing this with animals, and that makes the research, let's say, a little bit more complex of how you know if certain thing cause cancer. Now, I'm going to describe some of them. This, by no chance, this list is comprehensive or completely accurate all the time, because we always keep learning about new things and why certain things may or may not be true in the future. But let's go to what we know so far. The first one are chemical mutagens. And one that is very clear is anything related to tobacco smoke. Anyone that smokes for long periods of their life increase their chances of developing lung cancer at some point of their life. And this is true in every country, and many people know about it and they still smoke. And this is one that we can say, okay, these specific chemicals that are released when smoking and burning, they affect the cells, the line, the tissue in the lung, and they can develop mutations. We can then become cancer at some point of their lives. Another one is radiation. For example, UV radiation of the sun is associated with higher risk of skin cancer. That doesn't mean that if you take sun or you go into the sun, you will develop a, let's say, melanoma or a skin cancer. That's not that it is, but increase the chances. So one has to be careful and analyze the data accordingly. But another type of radiation, for example, nuclear radiation, those who have suffering from effects in nuclear plants or that were affected by the nuclear bombs, or were affected by these catastrophes with nuclear plants, they by sure they had increased risk and increased cases of certain cancers, because these radiation affect their cells and create mutations that at some point could develop in malignancies. Also, now we know that certain viruses also can cause cancer. And there's a specific type of cancer that are formed, for example, with the papilloma viruses. Another known cause is a weak immune system. What is known now that people, for example, suffering from HIV, which is a disease that affects the immune system of the people, of humans, they have higher chances of cancers, and a specific type of cancers which are not common in the general population. This also shows the importance of having a good immune system to fight cancer. And this actually will come later in this video, explaining how now scientists are using the immune system to combat and fight cancer. There's also one last one, which is people with genetic predispositions. That means people that are born with certain genetic mutations or hereditary diseases that can increase the risk of cancer. It's not causing it, but actually increases the risk because the body doesn't have the mechanisms to, let's say, protect or keep all the cells in their check and balances to avoid developing of cancer. One of them is, for example, the Li-Fraumeni syndrome, which is those who are a mutation in the tumor suppressor gene TP53, which probably some of you have heard if you follow a little bit of the cancer science, or those with breast cancer associated gene BRCA1 or BRCA2 could also, when those born with mutations with these genes, can also increase their chances of certain cancers. That doesn't mean that if you have this mutation or you have this, let's say, specific genotype that you will develop, but in terms of association, you have increased risk. For this, you will have to discuss it with your doctor. If you are at this risk, what would be the best step? This is just for understanding that there are certain predispositions that could cause cancer, but doesn't mean you will get it. The next question is, how is cancer detected? Early detection improves treatment outcomes. Depending on the cancer and the tissue affected, some of them can be actually early detected and be treated accordingly, and people can have very good life. And some of them, unfortunately, can only be detected because signs and symptoms start to appear when the cancer is already at the late stages, which is then very hard to treat. The most common one is a biopsy. And for a biopsy, usually requires surgery or require some type of acquiring a little bit of the tissue, which is think that it could be, for example, a malignant tumor that is growing. And this biopsy, this tissue then is sent to a lab to go to different, let's say, genetic tests or pathological tests to see if this tissue is actually malignant or it's actually come from cancer cells. And this is sometimes challenging because depending on the tissue, sometimes it's not really accessible or it will require a full surgery to be able to acquire this tissue. Some even people claim that doing biopsies can even actually be worse. This is still controversial, but just to show that there are still, let's say, scientists and doctors who say, well, we prefer not to do certain biopsies of certain tissues because they think this could make it worse. Another way to detect cancer is by blood tests. For example, for leukemia, which is a type of blood cancer, some of these already malignant cells or cancer cells can already be detected in the blood. So a blood test will be able to detect this type of cancers. And there's other things that are now being measured in the blood to see if there's some indication of certain cancers, and research is ongoing in this sector as well. And another way is with imaging techniques such as X-ray, CT scan, PET scans that allow the health professionals to see if there is some group of tissue that should not be growing in a specific area of the body and see if this is actually a cancer and can then allow the health professionals to proceed in the next steps to follow. Now, lastly, we want to just give a little summary of what are some of the cancer treatments. And the most common one for many cancer is just surgery. It's basically physically removing the tumor or the cells that should not be there from the body. And for certain tumors, this can be done easily, and for certain tumors, this is not as easy because of, for example, let's say a brain tumor, you cannot just operate the brain and take a tissue because it will affect the brain. While for other tumors, let's say a skin melanoma that is not affecting other tissue, it might be, let's say, easily removed by a surgeon. Now, this is usually accompanied with other treatments because what it's known is that surgeries can remove most of the tumors, but many times there's a few cells that can still remain in the area that cannot be easily removed or might not be seen by the surgeon. And then this is usually treated with some other type of with some other type of therapy to be able to clear the cancer. And this is when, for example, chemotherapy enters, because then you can use this to try to kill any remaining dividing cells that are in the area. And this, of course, have their side effects. And another way is with radiation therapy. This is depending on the site of tumor. There are certain type of radiation therapies that can directly, let's say, kill the specific tissue without affecting so much the other areas. There's, of course, some side effects, but as way the technology has improved to be able to reduce many of these side effects. And now, what it gets very exciting is go with personalized therapies. And this is what I was actually working as well in my research, and this is a lot of very interesting research going on right now, which is personalized therapies. And just for understanding, as we all humans are different, we have different genetic makeups that make us different, and we react different to certain things. Tumors are also very different. And even in a specific patient, they can have many different types of tumors with different genetic makeups. That's also what makes it harder to treat them, because you can treat one of them, but the other ones might be a bit different. So it's good to understand the genetic and molecular basis of the tumors and try to personalize the treatment to every type of tumor. Let's put an example. If you understand which genes are mutated in this specific type of tumor, then you can design drugs or molecules or whatever biologicals that can target directly this specific mutation. And this is what I also call molecular vulnerabilities, is that cells, when they develop this mutation that make them to become cancers, they can also develop some vulnerabilities to, let's say, other parts of the cells that healthy cells are not so affected. So it's like you're getting an advantage to become a cancer cell, but at the same time, you become weaker in other parts of the cell that healthy cells will not be affected. So for this, then we can design drugs directly to target this. And there's a lot of interesting research and a lot of people getting saved from specific cancers because of this. And the advantage is that the more precise that you can do this, and the better you understand the patient and the tumor, the less of side effects these treatments will have. And we hope in the future that we can easily understand which tumor the person has, and then have a catalog of possible personalized therapies to target directly the tumor and clear it from the patient. And this also comes with a now also very novel type of therapy, which is called immune therapy. And immune therapy, basically, the main idea is to use the patient's own immune system to clear the specific tumor or cancer for certain diseases. This is easily compared to other types of tissues that is not easily accessible, for example, by immune cells. And one example is, for example, when they use antibodies that could target specific tumors, and then these antibodies can then increase the immune attack against specific cancer cells. And another one that I have mentioned in other videos, which is very interesting, is this cell therapy. Basically, they grab your patient's own immune cells. The most common is the T cells, which is it's a part of the immune system, it's of the adaptive immune system, and they grab these patient's own T cells, they modify them in a lab to attack a specific type of tumor. Let's say, for example, someone suffering from leukemia or from lymphoma, they can modify these T cells to be able to target a specific tumor, and then they put it back in the patient, and then these cells now are engineered. Now they have, let's say, these novel weapons and armor, if we want to do an analogy, to target the tumor. And these have actually been proved successful. Of course, there's still so many side effects and there's still a lot of research going on, but many patients are now being saved because of these innovative treatments. They are, unfortunately, still very expensive, and a lot of time is needed to be able to design these cells, as they have to be from their own patients. There's a lot of work to be done, but many of patients are actually benefiting from these treatments. And a lot, as I always say, a lot of research is going on to improve these therapies and to make it cheaper and more accessible to the people. And we hope that in the future, some of them will be everywhere and people could be easily treated also with these type of cell therapies. Another type of therapy that is good to mention is hormone therapy. For certain type of cancer, for example, breast cancer, they thrive on using the host normal hormones to grow. So what they do now to treat it is that they give molecules that can block the normal work of these hormones or interfere in the production of these hormones. So now the cancer cannot use it to grow and divide. The problem is that these hormones, which are usually normally used by the host, are now depleted, and these also create a lot of side effects for the patients. So now we talk about some of the most common treatments that are used to kill the cancer, but many times people forget to mention some of the other treatments that are also really important for all cancer patients and also require a lot of attention and research, which is all the supportive care to first make the patient feel okay through all this complicated and challenging process, and also to decrease all the side effects. So every cancer treatment requires oncologists that will target directly the cancer and try to kill it, and surgeons, but you also need a group of supportive care made of psychologists, made of physiotherapists, made of other type of coaches, also other type of doctors, for example, endocrinologists and primary care, which are day-to-day trying to decrease all the side effects of all these complicated treatments that patients receive for cancer. And it's really important that everyone understand this process, because it's not easy, and the family and friends are there to support as well. And it's needed that a lot of conscience in these, let's say, side treatments, which are as important as the main treatment, to be completely funded to allow people to go through these processes. It's well known that when people feel that they have a supportive care, not just their family and friends, but rather also from the health system, with psychologists, physiotherapists, other supportive coaches, will help them to have even more successful treatments when dealing with these challenging times. So I hope you like this video, just to try to give a general overview of what is cancer and how it can be detected and treated. And yeah, if you have more questions, please put it in the comments. If you like these topics, I would like to talk more about this and yeah, let me know what you want to know, and I will go more deep into different type of treatments. Are very innovative and very cool, and I think a lot of people can learn a lot from this, and I learn a lot every time I'm researching for these videos. So thank you very much, and have a good one.